Welcome to Anesthesia Bits, bite-sized anesthesia and nursing education. In this quick video, learn about the oxyhemoglobin dissociation curve basics, including its sigmoid shape, P50 value, and why it matters for oxygen delivery in anesthesia. Welcome to Anesthesia Bits. Today, we're diving into how oxygen travels in your blood and why it sometimes decides to hop off the ride. It's all about the oxyhemoglobin dissociation curve with its shape, P50 value, and why that even matters for oxygen delivery.
So wait, how does oxygen even know where to get off in the body?
Great question, Tasha. Let's get Benny the red blood cell to show us.
Inside your body, red blood cells carry oxygen, and how easily they let go depends on something called the oxygen dissociation curve. Some call it the oxyhemoglobin dissociation curve, but it's the same thing. It shows how easily oxygen binds to hemoglobin in the blood based on oxygen partial pressure, which is measured in millimeters of mercury.
Think of me as a bus driver carrying oxygen passengers. My curve shows how willing I am to drop them off.
At high oxygen levels like in your lungs, Benny holds on tight. The high partial pressure of oxygen, or SaO₂, keeps the oxygen saturation stable around 97 to 100%. In tissue, like muscles, low SaO₂ allows rapid unloading of oxygen passengers. The P50 value, approximately 27 mmHg under normal conditions, corresponds to a hemoglobin saturation of 50%. So, when your muscles have low oxygen, Benny lets go of the oxygen he has been carrying. This difference in SaO₂ makes oxygen delivery efficient to where the body needs it the most. Importantly, at a SaO₂ of 90%, which is about a Pa02 of 60 mmHg, you're on the steep part of the curve, meaning even a small drop in oxygen pressure can cause a rapid desaturation.
But this curve doesn't always stay put. It can shift right or left.
Like when you exercise. More SaO₂, more acid or acidosis, higher temp, the curve shifts right. Benny drops off oxygen easier.
And if it shifts left, like in cold or low SaO₂ or alkalosis, or in carbon monoxide exposure, Benny holds on tighter.
So, why do we care about this curve anyway? In cases of anemia or at high altitude, we examine the curve to determine how well tissues receive oxygen. Chronic anemia increases the number of red blood cells and shifts the curve to the right, promoting oxygen release despite low hemoglobin levels. Acute anemia, like in a case losing lots of blood or a trauma, exacerbates the rightward shift. High altitudes, which are low oxygen environments, shift the curve to the right too.
And in carbon monoxide poisoning, the curve takes a sharp left, and Benny holds CO so tight oxygen can't even ride. And during surgery, acidosis and hyperthermia shift the curve to the right, allowing for better oxygen unloading to tissues. Hypothermia shifts the curve left, forcing Benny to hold on tight to his oxygen passengers. This risks tissue hypoxia. Under anesthesia, use fluid warmers, warming blankets, and increased air temperatures to keep your patient from getting cold. Monitor end tidal SaO₂ to maintain normocapnia, usually 35–45 mmHg.
Pop quiz! If you're running, does the curve shift right or left?
Right. More SaO₂ and heat makes Benny drop off oxygen faster.
Great job! That curve explains how your body balances oxygen delivery every second.
If your patient is cold, does the curve shift right or left?
Left. And that puts the patient at risk for tissue hypoxia.
That's the basics. For more quick dosing of anesthesia knowledge, check our playlists. Smash the like button, subscribe for updates, and let me know what anesthesia bit you want next. Thanks for watching Anesthesia Bits. Remember, my job as a red blood cell is to pick up oxygen and carry it to where it needs to go. The oxygen dissociation curve is my map, and on my delivery bus, the SaO₂ tells me how full the bus is. PaO₂ is just the free-floating oxygen. Fun fact, breathing 100% oxygen doesn't help if your hemoglobin is already full. Unless I'm under pressure, I can't pack any more oxygen passengers in the bus. Stay curious and keep your oxygen buses running.